Keeping our pearly whites shiny is important, and routine dental care can actually help with that. A-Plus Dental Care is a family group dental practice that provides a full range of dental services from x-rays to implants. And here to fill us in, we have Doctor of Dental Surgery Managing Partner. We have Timothy Herman. Hello, Timothy.
Good morning.
Okay, so great to have you on here. Fill us in. Tell us about A-Plus Dental Care and what can guests expect when they come to your offices.
So A-Plus Dental Care is a 45-year-old family group dental practice that when you call, you should get a smiling face on the other end of the line, welcome you to our practice. You will come in and see state-of-the-art equipment. We follow all OSHA guidelines to make sure everything's nice and sterile and our patients are nice and healthy.
Wonderful. Okay, and so what type of services do you offer at A-Plus Dental Care?
Because we're a group practice and we have 10 terrific general dentists, an orthodontist, a periodontist, an oral surgeon,
wow,
we take care of almost all dental wants and needs, from very basic preventive things all the way into implant surgery, gum grafts, very complex procedures, implants, and we do pretty much everything you need. And then by keeping it all under one group, that we know what your insurance maximums are and we help you so that you don't go over, but we utilize your insurance the best it can for you.
That's wonderful. Also too, because then that way consumers don't have to worry about getting care in one office and then having to shop for the specialist in another area.
Exactly.
And then the communication not being right for your care. That's brilliant, all underneath one roof.
One of the best things I've enjoyed over my career is actually sitting in a room with the patient and the specialist and me, talking about what their needs are and working with the specialist. You know, if you can do this, I can do this, and then the patient can make a decision right there. And we're not sending emails. And when I first started, it was sending letters, and now it's sending emails. But now we actually can make the decision, and the patient can have all the information right there.
That's fantastic. Okay, as a parent with 2 children that I know are going to need, you know, orthodontia down the road, and one who's already been through it, along with the dental care, so important there. Okay, all right, so why is it important, though, that we stay on top of our dental health?
Well, dental health is critically important because if you, as a small child, if you have dental problems, then you're probably not eating correctly, you're missing school, and so those things. As we get older, you know, no matter how good we are, and I think my partners are terrific, but our dental work doesn't last forever. So we're putting our dental work into a wet, warm, salty environment that has tremendous forces on it, so it's going to break down. So if you can keep you healthy and prevent dental disease, then you're less likely to need more dental work as you get older.
And let's talk about those preventative services. What do you do?
So the most important prevention, I think, in dentistry is the use of dental fluoride and sealants. And fluoride, we have fluoride in our water, the state mandated fluoridated water, if water agencies can afford it. In Roseville, the water's been fluoridated for about 50 years, and other areas of the state. But then also in-office fluoride treatments. And at our practice, if you get a fluoride treatment, we will bill your insurance, and if your insurance doesn't pay for it, we will. That's how important it is for us.
Oh, wow.
So there's nothing ever out of pocket for our patients for fluoride treatments. And then dental sealants are a coating that we put over the pits and fissures of your back teeth and help prevent you from getting cavities in there, because about 90% of all cavities get started in those pits and fissures because they're hard to clean even with toothbrushes. So if we can fill those up so bacteria doesn't get in there and produce acid to cause the cavities, that's really most important.
And let's talk about dental insurance, because you've hit on that just a little bit. What type of insurances do you guys accept?
We accept almost all dental insurances, all PPOs. We're a preferred provider for Delta Dental, which is really the largest dental insurance company. And Delta has different levels. They've got the Premier and the PPO. And if you want to get the best and most benefit from your insurance, seek out a PPO dentist, and because then the benefits go further, our fees are less, and the benefits go further. But we do accept almost every dental insurance, and if you want to give us a call and ask exactly, we'll tell you yes or no, but there are very few that we don't.
And what if somebody doesn't have dental insurance?
Well, a lot of patients have dental insurance, but those that do not, we came up with a dental fee plan, or a kind of a dental club, back when the recession hit in 2007, 2008, to help people so they didn't have to write a check to come in and get their teeth cleaned. So for a small monthly fee, they can come in and get a couple cleanings a year, get their exams and x-rays. It saves them a lot of money, and then they get 25% off of everything else that they do.
I'm so impressed.
That works really well for our patients, and it's amazing how when you take that impediment away, people come in and get their teeth checked.
Absolutely.
And we find things when they're small before they become big problems.
Yes, it's all to that preventative care that you're talking about. And tell us about your involvement in Big Day of Giving.
So little different. We've got not the big day of giving that's coming up that the whole community, we've got a day of giving for free dentistry.
Okay.
And our day of giving is in affiliation with the Smiles for Everyone Foundation. And this is the 3rd year in a row that we've done that. And so we are working with Weave and with Gathering In and some other nonprofits that help identify people in need. And so on April 27th, we are opening up our office in Roseville to take care of as many patients as we can. We're already full of appointments, and we've got about 50 people on the wait list. And so we're going to do fillings and extractions and cleanings. And then usually what we do is find a couple patients that need more, and then we just adopt them and get them completely healthy.
That's absolutely fantastic. Where do our viewers go for more information about A+ Dental Care, and then also about the day of giving that you're doing on April 27th?
A+ Dental Care, you can go to our website. It's aplusdentalcaregroup.com. It's APLUS, dentalcaregroup.com. And then for the day of giving, the best way to go is go to Smiles for Everyone Foundation Facebook page, and that's got the events and times.
Wonderful. Timothy, thank you so much.
My pleasure.
I am so impressed. What a fantastic opportunity you have presented for people when it comes to dental care. Greatly appreciate it.
This interview involves commercial content. The products and services featured appear as paid advertising.